Thank you. My name is Eric Forehand. I'm the Design and Brand Manager with the North Carolina Partnership for Children. We'd like to thank you all very much for attending our virtual conference. And while we're sorry we could not host the in-person one, we are thankful to have the opportunity to share all of this great content with you all with the network virtually. Before we start, I would like everybody to make sure that that their microphone is muted. So we've got a big crowd, which is nice, but sometimes you can get talked over each other. If there are any questions, we're going to save questions till the end. Please put them in the chat window, and the panel will take all the questions towards the end. And it's a good full presentation. So again, thank you for attending the Collaborating for Change in Compensation. I'm going to hand it over now to Marsha Basloe, President of the Child Care Services Association, to introduce the rest of her panel. Marsha?
Thanks so much, Eric. I will be introducing this presentation, and it's Collaborating for Change in Compensation. It's highlighting our North Carolina strategies. I had the opportunity to join this work the last 2 years, although it did start with Anna Carter and Allison Miller co-chairing a work group, and you're going to hear about that work group. We are pleased to be able to have a number of, actually, the slides are not moving, so there we go. We have a number of presenters today, and I'm pleased to say that we have Kristen Guillory from the Office of Governor Roy Cooper, Allison Miller from Child Care Services Association, Kristi Snuggs from the North Carolina Division of Child Development and Early Education, Rosemarie Vardell, North Carolina Institute for Child Development Professionals, and Donna White, the North Carolina Partnership for Children. We have an agenda in this hour. We're going to talk about compensation for early educators. We're going to tell you a little bit about Moving the Needle, which is the project that I mentioned. We're going to also talk about development of a salary scale. We'll share information on the National Governors Association grant that North Carolina receives through the Governor's Office, supporting states' policy strategy to improve early care and education workforce. And then we're going to talk about the Leandro potential impact on compensation. Should there be time in this presentation, we're then going to hear from you with some questions and answers about your community's collaborative efforts for compensation. So I'm going to start by talking about early educator compensation and really why does it matter? And compensation matters for lots of reasons. First and foremost, it is an economic justice issue. The early childhood education workforce deserves to be paid more for both the education they have and the importance of the work that they do. No one thinks it's fair that the workforce makes so little money. We also know that turnover can have a very negative impact on young children, particularly infants and toddlers, and that turnover is often related to low pay and benefits. The third reason compensation matters is that we really need an educated workforce. The National Academy of Medicine, through the Transforming the Workforce Seminal Report, recommends that all lead teachers have a bachelor's degree in early childhood education as a starting point. If we want educated teachers, we have to be prepared to pay them what they deserve. We also know that teachers who are living in poverty, who are worrying about how they're going to support their family, can't be as effective. Poor salaries affect program quality, as well as a teacher's health and well-being. And this is certainly made clear now during the COVID-19 pandemic. Finally, the workforce deserves a career pathway that recognizes increasing knowledge and skills with increasing compensation. So with all of this news and the data, what are the characteristics and opportunities we face in tackling this? What are the compensation challenges? Of course, our biggest challenge is that 70% of funding for early childhood education programs comes from parents, and many of whom are paying a much larger share of their family's budget than they truly can afford. We also have little or no funding or public policy targeted to addressing compensation. Although North Carolina did recognize teachers caring for frontline workers, and that's something that we really need to think about and hopefully can push forward. While the use of quality dollars are allowed to address compensation, there are no dollars specifically targeted to compensation of the early childhood workforce. There are not mandates within Head Start. There are not mandates in the block grant that require wages to be comparable to public school salaries for teachers with similar qualifications. In a few states and communities, there are parity requirements as state-funded pre-K programs were developed. Early childhood education is still not seen as a public good in the way that public education is. And the sad truth is that the funding is so woefully inadequate that we are pitting the needs to serve more children against the need to build high-quality programs that would make a lifelong difference for those children. And then finally, because of the very low wages, work within the early care and education field is not viewed by the workforce investment boards and sometimes within our higher education institutions as careers worth investing in. Just to give you some basic information, the North Carolina compensation data that we have is that teachers earn an average of $10.97 per hour. And you can see on this slide, really that infant toddler teachers are lower paid, but that the North Carolina living wage for one adult with one child is $23.89 an hour. It's not surprising that teachers who left say that pay is the #1 reason. And it's important for us to also know that 37% said that they would return to their early education classroom if their reason for leaving were addressed. So now that I've given you a little bit of a background, I'm really pleased to turn it over to Allison Miller, who's going to talk about the compensation opportunity and moving the needle. Thanks, Allison.
Thank you. Good morning. Again, my name is Allison with Child Care Services Association, and I work with the Child Care Wages Program and Infant Toddler Educator Awards, both of which are education-based salary supplement programs for the early care and education workforce. We have a variety of compensation opportunities in North Carolina, and we're going to highlight a couple of those today just to illustrate some of the collaboration that has occurred in our state around this topic. I'm going to be introducing our work with Moving the Needle on Compensation, which is a project managed by the Teach Early Childhood National Center. The center is part of Child Care Services Association, and it has a mission to develop and implement programs and strategies that result in a better educated, compensated, and stable early childhood workforce. They not only license the Teach Early Childhood Scholarship Program and the Child Care Wages Program models in states across the nation, but they also develop funds, they seek funds to support projects that address these issues for the workforce. And Moving the Needle on Compensation is an example of one of those projects. So participating states responded to an RFP, and we were asked to create our own compensation goals and work plans on any or all of the domains that you see listed here. We analyzed our state's compensation landscape, our needs. We developed a vision, goals, and a work plan with attainable steps, and we met regularly to work toward those goals. There were 8 state teams in the original cohort, including North Carolina, and we were asked to develop our membership based on a diverse list of community roles. And I think all of the states really took that diversity to heart, because we knew that if we were going to make a difference with compensation, that we really needed to collaborate with new and different voices at the table. And I'm very proud to share with you the membership of the North Carolina team that you can see on your screen. If you could go back a slide, Marsha, please. You can scan down that list and see who was participating. We had a very core group of participants, and we have now merged with members that were working on a compensation opportunity through the National Governors Association, The funders for this project were the Alliance for Early Success and the W.K. Kellogg Foundation, and that allowed us to have all 8 state teams participate. We got technical assistance from the National Center. It covered some team member travel, and we were also able to participate in a summit where we received professional development on compensation, and we were able to work directly with our state teams to advance our goals. The vision for the North Carolina team was that qualified early education teachers would have increased compensation moving toward parity with teachers in the K-12 system. And I want to point out a couple of intentional word choices here. Qualified in that our team focused on those teachers with levels of education that could make a difference in the classroom. And moving toward parity because we recognize our political climate and where we are currently. Next slide, please. Our goals in North Carolina are that a salary scale would be endorsed and used for early childhood teachers and assistant teachers. This really ended up being our primary focus, and Donna and Rosemarie are going to share more about that today. We wanted to develop, educate, and mobilize targeted stakeholders to champion increased teacher compensation, and Kristen is going to provide an update on some progress we've made in North Carolina on that goal. Increased compensation would be available in at least 3 communities or through at least 1 statewide measure, and enhanced compensation standards with increased compensation tied to degrees would be established. And I'll provide an update on those latter 2 goals. As I mentioned, the Child Care Wages Program is an education-based salary supplement program, and it's funded by local Smart Start partnerships that choose to participate. And if they do, then they provide the funding for the supplements, and the Division of Child Development and Early Education essentially pays for administration through CCDF, which makes it a more cost-effective option for partnerships to choose. And as part of our work plan for moving the needle, we had some additional outreach strategies for wages. And during that time, 3 new counties did join the Child Care Wages Program. Our team also advocated for a statewide salary supplement program. And when the Division of Child Development and Early Education made funding available to enhance the experiences of infants and toddlers in our state, Child Care Services Association was funded to implement Infant Toddler Educator Awards. Now that's based on the wages model, but it is fully statewide. It's in every county, and it is for full-time, well-educated infant toddler educators. In terms of having increased education standards with compensation tied to degrees, Michelle Rivest and the North Carolina Early Education Coalition really led our advocacy efforts with the legislature in the state on this topic. We made a lot of progress with the bill in the House, but we were ultimately unable to get it through, and so that work is still in progress. And I'm going to turn it over now to Donna and Rosemarie, who are going to talk more about our salary scale work.
Thank you, Allison. Good morning, Smart Start colleagues. I'm Donna White, the Interim President of the North Carolina Partnership for Children, and I'm pleased to be a part of this panel this morning to share the collective work that we have been doing to chip away at the early learning compensation issues in our state. Next slide, please. So salary scales are used in many organizations. All government agencies have salary scales, and many private organizations do as well, and for good reason. They provide clear, transparent pathways for how compensation can be provided, and this transparency is beneficial to both the employer and the employee, so they both can budget and plan, and it also gives clear information on what really is valued, whether it's education or experience, time in the position, or a combination of education and experience. And when you've gone through an inclusive planning process with research and vetting with the early learning communities and gain statewide agreement on a salary scale as we have in North Carolina, it can be even more useful. Next slide, please. Let me get rid of this. So how can they be used? First, to provide a model or guidance for early learning programs about what early educators should be paid, instead of each program trying to figure that out for themselves. Secondly, it provides a planning tool to compute the true cost of quality early learning for use at the program level, a community level, and at the state level for policymakers. It also offers early learning programs a target to aim for as they strive to better compensate teaching staff. Next slide, please. And so this target to aim for currently seems lofty, and hopefully in a few years it will be commonplace. We recognize that we need to work toward this in incremental steps, and the salary scale can serve as a basis for that incremental improvement as well. And in North Carolina, as you know, our QRIS is tied to our child care licensing system. And the use of a salary scale could be used effectively as a quality indicator or a component of a quality indicator. And lastly, I mentioned the cost modeling to understand the true cost of early learning programs, since most of the cost is staffing cost. North Carolina can use a salary scale to plan to increase reimbursement to programs over time to cover truly worthy compensation for early learning teachers. So Rosemarie, I will now turn it over to you to talk about our context and our process that we've used here in North Carolina.
Rosemarie, I think you have to unmute.
Okay, we'll start over.
Okay.
Thank you. So, Rosemarie Vardell with the North Carolina Institute for Child Development Professionals, and we focus on the education and compensation of the early childhood workforce. So we were working in the context that's familiar to most people in states, which is, as you've seen, the low wages and the resulting difficulty in attracting and retaining qualified teachers. Also, we had in our state, through the Institute for Child Development Professionals, we had models of salary scales that tied education and compensation. So we had a history of doing that for several years, but had not revised that recently. Also, the same group was starting to do work around wage parity, to take a look at that and what that might look like in our state. Also, teacher education levels have been increasing, but wages have remained stagnant. Also, our North Carolina pre-K program, when it started, parity was, wage parity was actually a requirement of that program. But over time, because of the difficulty of meeting that requirement with the reimbursement rates they had, that is now not required, it's recommended. And then we had the opportunity through the Moving the Needle team, as you heard, and that became a priority. So these were the beginning principles. Like many other states in, 2 or 3 years ago, there wasn't as much of this concrete work around developing parity with the public school system. So when I say beginning principles, this means as we worked together and had conversations about moving forward, this was what we began to focus around and use as our guide. The first thing is around wage parity. So we did not attempt to do full parity, meaning with wages and benefits. So we decided to focus on wages as the beginning point. And the underlying concept was There should be 100% wage parity for teachers with the same qualifications, the BK license in our state, as required by the school system. And that there would be a percentage of that for people without a license or with an AA degree. And lastly, that this would be a voluntary tool. We were not trying to put things in regulation, but to provide a tool. And Donna talked about how to use that tool. Okay. So what was our process? The committee developed a model salary scale based on the principles. So we did that work. And then we knew that we needed to get feedback from the field. And so we asked one of our universities, UNC Charlotte, to work with us to develop a way to get that feedback. So that was a study that was comprised of both individual surveys and some focus group work. The targets were teachers, administrators, and then organizations that provide support to the workforce. This study, actually, it was very positive in terms of the response. We were really wanting to hear if people had recommendations or things that they felt would not work for them. And we got very little of that. It was primarily positive. And the main concern, no surprise, was how are we going to pay for this? We would love to be able to institute this in our program, but we don't have the resources to do it. So that was sort of the main overarching response. We did take some suggestions and make some final adjustments to the scale, and then we refined our principles. So the scale that you'll see means that we worked with these principles, and then we took any feedback that we got from people. So now we come to what we really did, which was, so this became our final principle. So we kept all of the principles that, that we started with, but we added a couple things you'll see at the bottom of this slide. And one was the issue of equity between levels of wages. So essentially, equity in the amount of reward people got for increasing their education level. So this got incorporated into the scale, and we made a few changes in order to reflect that. And the last one was maybe, I would say, our most challenging discussion. And it was around the minimum wage of $15 an hour, which, as you know, is a common sort of benchmark at this point. And one of the other issues was, where does the scale start? And because this was around parity and looking at the amount of education relative to the public schools, we decided that the AA degree was essentially the start of this scale. But we felt it was important to also make a statement in that process about what's the entry level. Because we know that in our state, a lot of people still do not have that AA degree, although we've made a lot of progress on that. So some are starting with just the basic bare minimum that's required by licensing. And so we decided to take that, to make a comment by having an entry level step in there. So in the end, we felt like this minimum of 15, we couldn't really say for any kind of degree that you should be making less than $15 an hour. And so we made some adjustment with that as our guideline. And you'll see on the scale here that that AA degree is $15.14 an hour, and that ends up being annually $31,500. And so these are the numbers based on our current public school salaries. And the plan is if we're able to increase those salaries statewide, then we would make adjustments in this scale. And then the bottom one there, you see, we would be asked, in our state, we have an infant toddler certificate and a preschool certificate offered through the community colleges. And so that is, for this group, felt like that should be an entry-level place into our field in North Carolina. So this is what it finally looks like. And I I think we have, do we have next steps on our slide? Yes, good. So this scale, we plan to post it on our Division of Child Development and Early Education website. And again, it will be for voluntary use. The scale and the guide will be distributed to organizations and agencies that provide support for the workforce. And a word about this guide. As you can imagine, it would not be the most useful to people just to see this document with the, with the numbers on it, essentially. But we developed a 3 or 4 page document to accompany this that lays out a lot of the things that we're talking about today, sort of why we're doing this and how we did it and how it can be used both in programs to develop their own salary scales and then to provide another tool for advocacy. We're also planning to have some training that can support programs as they try to use this. Most programs, I would say almost all, to try to incorporate this scale would not mean that they could go from where they are to using the scale fully as it's stated. So what we want to do is offer some training that says, here's how you can begin to incorporate this and develop your own scale that's related to and based on this one, even if you can't get to 100% right away. So we really want this to be able to be used as a tool, and to help support that, we're hoping to have a webinar to be able to introduce it and let people know how to use the tool. So
thanks, Rosemarie. Rosemarie and Michelle Rivas actually did a lot of work on the scale and the guide that the committee then all reviewed before we were able to present it to the division. And so it is now in the division hands as a voluntary salary scale.
Yes. Thanks.
I will move us now to Kristen.
Good morning. So following in the footsteps of the Moving the Needle effort, the Governor's Office applied to participate in a National Governors Association Policy Academy for strengthening the early care and education workforce. You can move to the next slide, please, Marsha. Our application was successful, and we joined a cohort of states that received technical assistance and attended national policy meetings to support policy efforts at the state level to advance the workforce. We also received a small grant for state-specific work. Our state focus for North Carolina was collaboration with Moving the Needle and building upon those accomplishments. Our team decided to use the NGA grant to advance the collaborative conversation about increasing public awareness. We identified that low public awareness about compensation issues in the early education is a barrier to progress. Greater awareness is needed to drive policy and to build momentum for action. We partnered with a national consulting group, School Readiness Consulting, for additional technical assistance and more effective strategies. We identified our target audiences, which include policymakers, the business community, the early education provider community, including teachers, administrators, and higher education, and families. We wanted to think collaboratively about the messages to use with these audiences to help drive state policy toward improved compensation. The project with School Readiness Consulting included 2 facilitated strategy sessions with a group of stakeholders who worked together on messaging. During the strategy sessions and in work between sessions, our School Readiness Consulting partners used a storytelling framework for messaging. They promote storytelling as an effective tool for more persuasive communications. They worked with us on elements of a good story, specifically messages that directly to the interests and priorities of each target audience, and story elements that address both logic and emotion. Logic includes facts and data, and emotion includes testimonials and examples of impact using the authentic voice of children and early educators. Through our work, 3 recurring themes emerged. The first one was to focus on the impact on the economy, specifically that early childhood educators play a vital role in supporting our state's workforce and in supporting economic development. The key message we discussed is that early childhood educators are the workforce behind the workforce. The second theme was to focus on the early childhood education provider. Low compensation and lack of understanding of the vital role early educators play is driving many from the field and discouraging others to enter, resulting in a growing lack of access to childcare. The key message is North Carolina is facing a childcare crisis. The third theme was to focus on children and families. Families need reliable childcare to stay in the workforce, and children need a high-quality early education. The key message is every child deserves a high-quality teacher. We worked on developing effective stories around these key messages. Here's just one example of a targeted message to use with the business community. A shrinking early childhood workforce is creating a childcare crisis, making it difficult for families to work. The cost of replacing a parent who leaves the workforce is higher than retention. Your partner for business success is the early childhood teacher. As our grant ended, we discussed next steps. There's interest in developing a public awareness campaign, but no organization currently has the funding for a large-scale coordinated campaign. We agreed that continuing to find ways to keep the collaboration going and amplifying the strongest messages together will help keep us moving down the path toward improved compensation.
Thank you, Kristen. Now we're going to move to Kristi Snuggs.
Good morning, everyone. I am happy to be here and be on the panel this morning. And I just want to speak briefly to the Leandro versus the state of North Carolina case that's been ongoing, and to show you how other efforts in North Carolina are continuing to support the work of the salary scale that has been developed here. So Marsha, if you'll move on, thank you. As many of you probably are aware, the Leandro case affirms the fundamental right of every child to have an opportunity to receive a sound basic education. In January of 2020, a consent order signed by Judge David Lee identified 7 required components to address critical needs in public education and to ensure that the state is providing the opportunity for a sound basic education to each North Carolina child. We are happy that among these provisions that were outlined, one of the 7, the consent order identified as early childhood, a system of early childhood education that provides access to high quality pre-kindergarten and other early childhood learning opportunities to ensure that all students at risk of educational failure, regardless of where they live in the state, enter kindergarten on track for school success. So currently, the Department of Health and Human Services, along with the Division of Child Development and the Governor's Office, is working on developing a plan to comply with the January 2020 consent order around early childhood education. This consent order recognizes that the volume and quality of the early childhood pipeline in North Carolina is insufficient, and that the turnover in the early childhood workforce is quite high. We have heard and we recognize that there's an early childhood pipeline crisis. However, recommendations included in this plan and in the work that has been done talk about increased funding for salary supplements. It also identifies parity for licensed early childhood teachers and to pay on a salary scale or schedule for those AA licensed teachers or BK licensed teachers or any higher degree. Even during the COVID-19 crisis that we're all that is around us right now. Our early childhood teachers were called on to provide care for essential workers. We at the division wanted to recognize how underpaid they were and how important they were. And so we took those quality dollars that we received from CCDF and we created a bonus program for those teachers. With additional funding received from the CARES Act, we were able to increase those bonuses so that we're happy to say that by the middle of this month, all of our teachers that have been working throughout this crisis will receive a $950 bonus. Interestingly enough, that bonus was calculated on the same mechanism that was created for this voluntary salary scale that we've talked about today. And so that teachers with this bonus would be compensated at around $15 to $16 an hour. We are thrilled that we were able to do that. We just wish that there were more money to continue to do this work. The role of collaboration is going to be key in moving these recommendations forward. We've all heard the old adage of it takes a village to raise a child. It's going to take a village to move this forward.
Thank you, Kristi. I think what we're going to do now, we actually have done a really nice job of cutting down an hour-and-a-half presentation into a shorter period of time. I think that we were all a little concerned with whether we were going to go over. So what I want to do before I open it up for questions is I want to mention that this topic is not going to go away. On April 13th, the Brookings Institute had a blog that came out titled, "Are Preschool Teachers Worth More Than They Were 2 months ago?" And it said, I'm not going to read you the whole article, but it did say that the research shows that high quality care is the real difference maker, particularly for children from low income backgrounds. Providing high quality care requires excellent educators who are well versed in child development, early childhood teaching and learning practices, and have a bachelor's degree or specialized certificate in early childhood. To attract and retain these talented professionals, we must compensate them in a way that signals the respect and gratitude we feel for how they nurture and cultivate the future citizens of society. Now is the time to demonstrate how we value our early educators. They are charged with educating the nation's greatest resource. How can we show the value we place on what they do? We can start by offering competitive wages that convey the message that early childhood education is a fruitful career path, vital to the success of our nation. So I'm now going to move us, if it's possible, to figure out whether we can unmute people and ask people if they would like, if they would like to share some of the collaborative efforts that you've made on the call in your community.
I think that folks can unmute themselves, and if not, if you want to raise your hand in the chat, I'll try to help you out.
Marsha?
Yes.
There's one comment or question in the chat asking if we can show the slide again that has the actual salary scale.
I will absolutely, well, maybe actually. I will try and do that, yes.
Thank you.
Like I said, maybe. Here we go. Whoops. So this is the scale. I think what I'm going to do is I'm going to read a couple of the comments that we have. Will we receive a copy of this PowerPoint? I do believe that, that you will receive a copy of this. Smart Start is actually taping all of them. And thanks, Linda. Our teachers are very appreciative of the bonus. I think that everyone has been really appreciative of the bonus. And this is the copy of the salary scale. Tony said, I'm grateful for the tangible acknowledgement of the contributions of our early educators, and it is truly appreciated. And I think that's really to be said from the work that North Carolina has done to raise the awareness of early childhood education and the importance of compensation from both the work of moving the needle as well as the National Governors Association work on messaging. Are there any questions that we have that we can answer for you? Is there anyone who might want to share what's happening in their community? I know that we have 125 people on the call, and so we would be happy to have you share, if you'd like to, any of the work that you're doing in your community around the salary scale, around compensation, around pre-K parity, if anyone is interested in sharing. Otherwise, I'm trying to stay. So one of the questions we have is, I'm really interested in messaging and the stories, can they be shared? And I think, Gail, I'm not sure that we actually specifically developed a number of stories. What we did learn is that the stories, it is all about stories. Kristen, do you want to address the question about what we did around the stories work? Thanks.
I think we all agree. We wish we could have had more time. We were starting to develop some really good stories, and we just, ran out of time and grant funding. But we did work using a document that School Readiness Consulting provides called a Telling Toolkit, which is a really useful, easy to read, easy to follow, a guide for how to develop stories and how to implement them in your ongoing work. I think it would be relevant to any organization that wants to work on messaging, both on crafting the stories and then getting the stories out through using different communications tools. So we can certainly share that. We also have a summary of the work that we did from our consultants, and I can share that final report from the work as well.
And Kristen, maybe we can share that with Smart Start so that it can go with the slides once they're posted.
Yes.
Terrific. I'm going to go back to the chat and how does the salaries, and so a question for everyone, how does the scale parallel reimbursement rates from DSS subsidy? Is there anyone on our work group who might want to respond to the salary scale and how it relates to DSS subsidy? Let's remember that there is nothing in legislation that specifically addresses compensation. So although programs may get subsidy, there's nothing that says you must pay your teachers X amount of money. Kristi, do you want to add to that at all?
Hey, Marsha. Yeah, I was sitting here thinking, I knew you were going to ask me that
Of
question.
course you did.
You're exactly right. Right now, our subsidy, even though there's many different rates across the state based on star level, based on tier of the county, based on the age of the child, there is nothing that directly says that you should take that money and use it for teacher salaries. We have talked about that in the legislation that was mentioned of how we might be able to pair it and pay for it through our subsidy system. But at the current time, unfortunately, there is nothing that is directly aligned.
Thank you. We have another question, another comment. Patricia, I heard some points also that I'd like to publish in our local paper. Please do that. That's all about getting the messaging out. And remember, when you do that, come up with a story that really illustrates the message that you want to share. I'm moving down. With all we know about brain development from birth to 5, the first 2,000 days initiative, etc., what are some of the still existing challenges in convincing law policymakers that North Carolina needs to make early education part of the state ed budget and provide a true supplement to bridge the gap in compensation? I think that the message that came out from the Brookings Institute about what's happened in the last few months is that early childhood has stepped up, and that, you know, really it is a question of, are our preschool teachers worth more than they were 2 months ago? I think that there's a stronger recognition. I think the fact that the state is compensating programs and teachers the way that they are in North Carolina sends a strong message. But I also think it's a matter of reaching our legislators who make the funding decisions. Anyone else want to add to this? Okay, I'm going to move.
I will say it's certainly linked to the Leandro case. That linking early education as part of the fundamental, basic, sound education that every child in North Carolina deserves. And we have we haven't in the, what, 27 years or however long it's been that Leandro case has been alive, moved the needle yet on having our legislature fully fund our education system. And so there's still a ways to go there. I don't know if Kristen would add anything.
And Kristi, your picture came up. Does that mean you want to add something?
I'll let Kristen go and then I'll make a comment.
Okay.
No, I agree with Donna's comment. I think I encourage everyone to pay close attention to the Leandro work and how it develops, because I think it is a strong, it gives the advocacy for early education as a critical of our education system, a real strong boost. And the messaging coming from Leandro is very clear.
Great.
And Marsha, this is Kristi. I would echo what both Kristen and Donna have said. That was going to be my comments as well. But there's other initiatives like NAEYC's Power to the Profession that also speaks to salary as well. And, you know, I think it just goes back to we have a mixed delivery system within North Carolina. And even when we get legislators to listen and to hear and to understand the importance, we still have a whole group of private childcare providers that when you start, even though they may be in favor, they don't want the state telling them how to run their businesses and what kind of salary scales to use. And then there's the question of, even though I support this, how is it funded? So unless we get the legislators to really buy in and help fund the full education system starting at birth all the way through, I think it's extremely important. And I think Leandro is the place, as Kristen just mentioned, to really watch. I think we will see some changes. And I think the fact that early childhood teachers were so critical during this crisis is also a time, as you've mentioned, Marsha, that they really have stepped up, and the emphasis around them have become stronger. So I'm excited about what's to come.
Thanks. And I want to give a shout out to Kelly Shaw and Bonnie Gould from Craven Smart Start who mentioned that they have created a training for their providers on this, and they created it for their master's program. And so we look forward to actually seeing that being shared beyond. Jane asked, has a link between adopting a scale and subsidy reimbursements been considered? And I think that Kristi did actually answer that. And when she talked about all that's being done right now at the state level.
Marsha.
Amy. Oh, go ahead.
I'm
Allison.
sorry, I just also wanted to say that we did discuss a lot about the potential connection to QRIS. And so as work groups sort of look at possibilities within QRIS, which is part of Jane's question about the star rating and could the salary scale be connected in some way, we were talking about what those options could be. So we certainly hope that will be part of future discussions regarding QRIS, because it does seem like a very good opportunity for us in North Carolina.
Thank you.
And Marsha, this is Kristi. I would just add, we've had a work group working on our QRIS, and that has been in the discussions. So hopefully that is something that we can move on in the near future.
Amy Berry commented that as a participant in the Framing the Message session, there was agreement in our work group that shifting the message to the business community from early educators are the workforce behind the workforce to early educators are the workforce behind your workforce is even more powerful. That's great, Amy. Thanks for sharing that. I think that can be language that we can use, that we are the workforce behind your workforce when we talk to the business community. Nancy Griffin says that subsidy also needs to account for other costs such as care of facilities and land costs, as well as compensation. I'm just going to say that for this presentation, we're focusing on compensation, but I think that really there are all kinds of costs that need to be, to be taken into consideration when a program figures their budget and taking children who have subsidy dollars. Mary Scott says, I work with the Children's Council in Watauga, a Smart Start agency. We have a Pathways to Accreditation program where early learning centers and homes can voluntarily sign up for a year-long program that offers high-quality trainings and professional development, along with pre- and post-class assessments. We use braided funds, dual subsidy, and county funds to offer enhancement to these sites. In turn, they agree to pay their lead teachers a minimum of $12 an hour, up from $9.50. And so it sounds like you're really, I'm not going to read the whole thing and keep going, but it sounds like you're making progress and that you would like to raise the teachers' wages to the $15 an hour, but that your county has stepped up to really begin to make a difference. So thank you so much for that.
And on top of that, they also, Watauga funds wages, which provides an additional compensation support for the workforce.
Absolutely. Tristan says, if there's a link between subsidy rates and the scale, could there be a modest reduction of the rate for facilities that continue to pay at or very near minimal wage? I think we've addressed the fact that that is something that's going to be looked at in the future, and it could be done through the star rating system. And I'm going to keep moving us down. Kelly Shaw shared the link to what she told us, so that if you go into the chat, there's a link there. And I'm going to go back to Amy in Buncombe County. The local partnership has a program that provides unrestricted grants to 4- and 5-star rated programs to help them maintain high quality. And we added a bonus payment to programs that pay a living wage. Yes. Fabulous. It would be wonderful if we all had the dollars to be able to do that so that we could pay a living wage for all of our early childhood educators. I'm going to roll up and just see if there's any last minute questions as we close the session. I want to thank you. We had a number of people who were on the session. I want to repeat that this session was collaborating for change in compensation. It really was about the work that North Carolina has done in a couple of different areas. both Moving the Needle project as well as a National Governors Association grant through the governor's office. It shows, besides the work that Wages and Awards does around compensation, it shows that North Carolina continues to focus on the early childhood workforce, and we do believe that compensation is important. Thank you so much for joining us today, and I'm going to turn it back to Eric, I think.
And yes, thank you so much, Marsha. We'd like to thank all of our panelists for an amazing presentation, and the attendees for all of their great questions and sharing of their stories. Yes, thank everyone for coming, and I would like to say that this has been recorded and will be put on the conference website as soon as we can, along with the slides, this PowerPoint presentation here, and if there were stories that were going to be collected, I think I heard that said. So again, thank you so much for coming, and have a good afternoon.